Welcome to Thursday's edition of COVID-19. I'm Min Son-hee. In today's coverage, we touch upon the quest for a vaccine against the virus and the safety concerns surrounding this effort, as observers believe the quest is being driven by politics, not science. Now, we have more on that later on the program. First, here are the latest numbers on the pandemic with our Kwon-soa, as always, and related news with our Yoon Jung-min. So we are back on the triple digits here in Korea. Please do tell us more.
Yes, and this Thursday, it's not only the total daily figure, but also domestic infections that are above 100. And that is as we are seeing continuous sporadic cluster infections here in the capital, Seoul, and surrounding areas. Some recent cases were linked to a supermarket, offices, a daycare center, and other facilities. In the metropolitan region, over 90 cases were reported this Thursday. Let's take a closer look. We have the highest number of infections in Gyeonggi-do province at 48, followed by 39 in the capital, Seoul, and 10 in Incheon. And also down south in Busan, there is a concern with a number of new infections, 7 to be exact. We also have 15 cases that were categorized as imported cases this Thursday. So if we take a closer look at our graph now, with 15 imported cases, that means 110 domestic infections. And that was the number we saw yesterday when it comes to the total caseload, which has risen to 125. And with that, the entire nation now has a total of 23,341 infections. The death toll stands at 393 as 5 more people have lost their lives in the span of a day. But there are also more than 180 people who made a full recovery.
Right. So now, before we take a look at the global numbers, I hear Korea's BTS had a few words of encouragement amid the pandemic on the UN platform.
Right, Sunny. It was the second appearance of the boy band on the international stage at the UN General Assembly. It's the 75th this year. Only this time it was a pre-recorded message, of course, due to the pandemic. Even though in a global crisis like this, the speech might have been even more inspiring. So let's take a look at this short clip.
It might feel like it's always night and we'll always be alone, but the night is always darkest before the first light of dawn.
In a world of uncertainty, we must cherish the importance of me, you, and us.
Life goes on.
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 Life goes on. Let's live on.
Let's live on is what they said. And also let's hope that we do actually see BTS on the actual stage at the UN headquarters very soon. And hope is needed across the world as the figures are continuously rising when it comes to COVID-19 infections. Here, over 32 million cases are reported across the world with almost 982,000 fatalities. And in the meantime, we have some 23.67 million recoveries. Let's take a quick look at the hotspots around the world. 7.1 million in the US, followed by India at 5.7 million. These 4 countries here, over 1 million cases, and still not much of a slowdown in Latin American countries like Peru and Mexico. And resurgences in Europe, which means re-lockdowns, which includes France and the UK. And we also see a change of order here. Turkey has surpassed Pakistan in total cases, and Iraq has surpassed Saudi Arabia in the past 24 hours. And those are the figures I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Staying with the pandemic, the presence of a vaccine is expected to pave the path to yet another challenge, that of fair global distribution. I have our Yoon Jung-min here in the studio with me with more on that effort. Welcome, Jung-min.
Hello, Sunny.
Right, first, Jung-min, tell us about the COVAX facility, which I hear has been established to ensure fair distribution, or fair access, that is, to vaccines.
You're absolutely right, Sunny. So the COVAX facility is a global initiative to bring governments and vaccine developers together to ensure equitable access to coronavirus vaccines. And of course, South Korea is also an active participant and one of 172 countries that are engaged with the Global Access Facility. Take a look at what President Moon Jae-in had to say at the United Nations General Assembly this week.
백신과 치료제 개발을 위한 국제 협력뿐 아니라 개발 후 각국의 공평한 접근권이 보장되어야 할 것입니다.
The South Korean leaders said the UN's policy of inclusive multilateralism should benefit low-income countries when it comes to vaccine. 14 countries, including South Korea, issued a statement on Monday saying they strongly support vaccine multilateralism. They say the COVID-19 vaccine should be regarded as public goods. Led by Singapore and Switzerland, these countries form a group named the Friends of the COVAX Facility. Other joining members include Australia, the UAE, the EU, and Japan. The group was organized to ensure fair and equitable access to safe and effective vaccines for all. They support the COVAX facility's plan to deliver by 2021 2 billion doses of COVID-19 vaccines that are safe and effective.
Right, hopefully that will be the case. Now, tell me a bit more about how this facility is structured, Chongmin.
Sure, Sunny. So to give you a quick look at how it works, the COVAX facility is working with Vaccine Alliance Gov'T, which plays the role of a distributor, as well as the Coalition of Epidemic Preparedness Innovations, which is a vaccine developer. All of these bodies are overseen by the World Health Organization at the helm. You may also wonder how much the vaccine costs. According to the COVAX, it's $10.55 per dose on average. It's only an estimate because they don't have vaccines yet. Vaccine candidates are still undergoing clinical trials, so the prices may change when they are actually ready. COVAX provides two arrangements for purchase, and those are committed purchase agreement and optional purchase agreement. Under the committed purchase agreement, a country pays a lower upfront payment of $1.60 per dose. Under the optional purchase agreement, they pay a little more as an upfront payment, $3.50 per dose, and they have greater choice of vaccines within the facility's portfolio.
I see. I also understand that the top health body is urging for greater global participation in this joint effort.
You're right, Honey. So a diplomatic source in Seoul here says that over 80 countries have so far shown interest in joining the initiative. And the WHO is also encouraging more countries to join the alliance. Among those who are not in the facility are the US, India, China, and Russia. It's a little surprised that the US is not participating in the body, considering that President Trump has been lashing out at the WHO and China. Even at the UN General Assembly speech, Trump said the UN must hold China accountable for its failure to control the outbreak. The WHO's chief, on his part, is encouraging more countries to join the facility, including China. Take a look.
We are at a critical point, and we need a significant increase in countries' political and financial commitment. We're encouraged to see a large number of countries signing up to the COVAX facility.
And it's because the WHO and COVAX need more funds. They say the more, the better. The chief added they have so far secured $3 billion, which has resulted in a successful startup phase. But he says it's only a tenth of the $35 billion needed to scale up their efforts.
Right, Chongmin, now before you go, a few words on Korea's plan to secure vaccines for its people.
Sure, Sunny. So the South Korean government aims to secure vaccines for around 30 million people. That's roughly about 60% of the total South Korea's population. And by the end of next year, the government aims to secure vaccines from COVAX, amounting to around 20% of the population. For the other 40%, it plans to purchase from various global vaccine developers and are negotiating with several pharmaceutical companies. And the government is also supporting local vaccine developers, ranging from financial support to clinical trials.
All right, Chongmin, thank you for that coverage as always, and I hope to see you again soon.
My pleasure.
Right, it's time now to join the regular government briefing on COVID-19 here in this part of the world. Schools in the metropolitan area have entered their fourth day of offline classes with no major disruption so far. To minimize the risk of infection, kindergartens, primary and middle schools are keeping their attendance level in each class to 1/3. High schools are keeping that level at 2/3. The only exception to the rule are classes for seniors who are poised to sit the National Scholastic Test later this year. Meanwhile, the The recent rise, that is, in daily caseload, with 110 cases yesterday and 125 cases today, authorities are reiterating calls for public vigilance, especially ahead of the Chuseok holiday, which begins next Wednesday. Here now is a reminder of a few of the new guidelines in light of the Lunar Harvest Festival. To discourage travel during the family holiday, dining and drinking establishments at rest stops will not be allowed to offer on-site dining, meaning they can only cater to takeout services. Also, highway tolls will be collected this year. Now, previously, such tolls were not collected during the Chuseok holiday period. Relevant officials have also decided to close national cemeteries during the same period to again discourage the mass movement of people. Now, Chuseok calls on family members to pay their respects to their ancestors as well. But this year, in light of the pandemic, authorities are calling for the public to refrain from activities that could trigger another large-scale outbreak. Now, we are still waiting for the briefing to commence, and I believe the briefing is about to start. We'll come back to you afterwards with a summary of it.
양해 말씀드리면 백신 수급과 관련된 내용은 내일 저희가 별도의 조사 경과에 관련된 내용 브리핑
In relation to the vaccine development and the vaccine supplies, we will be briefing you more on detail tomorrow. And today we will be sticking to a COVID-19 related briefing. So let us now begin our briefing. Today, our briefing will be carried out by Mr. Lee Sang-won.
먼저 단장의 설명이
First of all, we will hear from him.
코로나 감염증 국내 발생 현황을
Let us now begin our
말씀드리겠습니다.
regular briefing for the COVID-19 response here in South Korea. As of September 24th, Thursday, we have 110 new local infections and 15 new imported cases. And the total caseload now stands at 23,341.
현재는
Currently, we have 2,116 people in quarantine, and there are 126 people who are in severe or critical conditions. And yesterday, we had 5 additional fatalities, and the accumulated death toll now stands at 393. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates on major domestic infections by region. Starting from the Severance Hospital in Seodaemungu District in Seoul, we have 8 new confirmed cases, and among them 6 were the contacts who were previously have been made into contact with the confirmed cases. And so far, in relation to the Severance Hospital, we have a total of 58 cases so far. And in Gangnam-gu District, in relation to Daewoo-Deoville Plus, we have 2 additional cases being confirmed. In total, we have 43 cases to date. And in Gwanak-gu District, we have the Sammo Sporex sauna. And in relation to this place, we have 4 additional cases. In total, we have 20 cases being confirmed to date. And in Gangseogu District, in relation to an nursing and daycare center in the Gangseogu District, we also have confirmed cases, and including 12 people, including the teachers and the students, as well as their families, and we have a total of 13 cases to date. And in relation to the LG Twin Tower in Yeouido-gu District, we also have additional cases being confirmed, and a total of 4 new cases have been confirmed to date, and in total we have 5 cases to date. And in Goyang City, Gyeonggi-do Province, in relation to the Pagye-won, which is a mental care facility, we have additional cases being confirmed. In total, we have 39 cases being confirmed to date. In Gyeonggi District of Seoul, in Incheon City, in relation to the Saengmyeong-gil Church, we also have additional cases, 6 additional cases that is, and in total we have 7 cases being confirmed to date. In relation to Pohang City, Saemyeong Christian Hospital, we have 3 additional cases being confirmed. In total, we have 12 cases being confirmed to date. And in Busan City, in relation to an health product business seminar in Yeonjae-gu District, we have 1 additional cases being confirmed, and a total of 18 people have been confirmed to date. In Gukgu District of Busan City, we have a restaurant being confirmed, and we also have 3 additional cases there, and in total, we have 16 cases being confirmed to date. And if you are willing to receive more information, we will provide you with these information going forward.
다음은 해외 유입
And next, let
환자에
us
대해서
now look at
설명드리도록
the imported
하겠습니다.
cases. Today we have
9월 24일
a
기준으로
total of
해외 유입
15 new imported cases as of September 24th, and among them, 5 have been reported at the points of entry, and among them, 12 are foreign nationals. And by a region, we have 10 from Asia, 10 from Europe, as well as 10 from Asia as well. And we also continue to note that we are seeing cluster infections repeatedly at the door-to-door sales facilities. First of all, we need to remember that the COVID-19 does not have an uniform infection rate. It could also have big discrepancies among the people, and even though they were inside the same cluster, each of the members and individuals could have different symptoms and different degrees of the disease. And please note that a confined, crowded, and close contact environment, it is an environment where the virus can spread very fast, and therefore if the people who were enclosed in these areas were senior citizens, or if they had chronic illnesses, they will be more prone to infections, and even with more severe symptoms. And we believe that they will be exposed to the virus even more if they share food, and also they chant as well, and when they also engage in group activities like chanting or singing and dancing. And we would also like to note that the time of exposure is very important as well. If they have a longer time of exposure, you have a higher chance of infections. And door-to-door sales facilities, we believe that it satisfies all of these conditions for the virus to spread. So if the senior citizens have been gathered at these information sessions hosted by the door-to-door sales facilities and they engage in diverse activities, it will be very dangerous for them to get infected. Even though they wear their face masks, it is very difficult to prevent the disease from preventing themselves from getting infected. And we also have seen international reports that face masks help reduce the infections by about 75 to 80%. And it is also, of course, very important to wear your face mask at all times, but you cannot be complacent when you wear the face mask. And for instance, in Daegu City, we also had a health supplement information session, and there are also related and similar information sessions being held nationwide. And in this specific case, we have seen the first index case was at the information session, and this has spread the virus to 25 people in the facility, and the infection rate was about 66%. And another person who was at the information session went to a facility in Cheonan and also spread the virus, and 5 out of 9 people were infected, and the infection rate hovered around 56%. And one of the staff members of Greenleaf, which is a door-to-door sales, went to another facility and also had spread the virus to another 7 people. And this shows that how COVID-19 can spread very easily and very fastly as well. At the information session, the infections spread, and it also spread through family members and their families and office spaces, and it spread to 6 cities and provinces, and in total 56 patients were confirmed. In total, right now, all of the epidemiological investigators are exerting their full efforts to trace down the possible contacts. However, it is very difficult for us to track down each and every one of those who have become into contact. And therefore, it is very important for us to prevent ourselves from the virus at early hunt. We will be going through Chuseok holidays very soon, next week indeed, and we would also like to take particular precautions and also spread these words to your elderlies as well. Thank you very much.
Right, that was Lee Sang-won, Director of the Epidemiological Investigation and Analysis Task Force with Thursday's afternoon briefing. So, do give us the gist of his address today.
Yes, it looks like a new face at the government briefing, and he talked actually a lot about face masks, but not to rely too much on them, because for instance, at door-to-door businesses, sales businesses, there were some cases where there were a lot of infections, and although sometimes they were wearing face masks, there was a spread to other people, and that, as studies showed, that face masks, protective masks, can protect you 70% to up to 85%, which means you cannot rely 100% on those. And he also mentioned that one of the information sessions related to a door-to-door business, 25 people out of 26 people in that session were infected by one person. So you can see how that is a really place with high risk of infection. And in the meantime, there were also many new infections in the capital, Seoul, related to the Severance Hospital, for instance, which now has a total of 58 cases, and also in Gyeonggi-do Province and a hospital in Pohang and Busan. So these cluster infections are continuing, which is why we have to be careful, especially with the Chuseok holiday coming up next week.
Right, that is true. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Korea's initial strategic response to COVID-19 was possible largely owing to its efficient test kits. In this next report, we seek to answer inquiries about these kits, which are based on real-time polymerase chain reaction. We tell you now what that means and more.
Today, we visited a local medical firm based in the central part of Seoul. Here, a maximum of 15,000 test kits can be analyzed in a single day to determine the presence of COVID-19.
선별진료소라든지 아니면은 병원에 가서 검체를 확보한 다음에는 그 확보된 검체를 추출 과정으로 들어가는 프로세싱을 이 방에서 진행하고 있습니다.
A real-time polymerase chain reaction method, or RT-PCR in short, is now widely used in the diagnosis of COVID-19.
네, 세계의 유전자가 즉 코비드19의 특이적인 세계의 유전자가 타겟 유전자가 이 튜브 안에 들어가 있습니다. 이런 것들이 환자 검체랑 믹싱하는 과정을 우리는 PCR 셋업이라고 이야기를 합니다. 그 PCR 셋업 과정을 통해서 PCR 리액션이 이루어지게 되고 그 환자가 코비드 검사 결과 양성인지 혹은 음성인지를 확인할 수가 있게 됩니다.
RT-PCR testing provides the most reliable and accurate diagnosis of COVID-19. And a test standard developed here in Korea has now become a global benchmark. However, on rare occasions, the tests are known to have yielded false positive and negative results.
키트 자체 제품보다는 검사하는 과정에서의 오류가 있을 수는 있습니다. 특히 감염 정도가 심하지 않은 경우에는 조금 그 샘플링하는 위치에서 벗어났거나 할 때 바이러스가 많이 있는 곳에 채취를 못하는 수가 생겨요. 그 피할 수 없는 사실은 어려움이거든요.
Also, can test results vary if you have contracted influenza or if your test samples are analyzed in a different lab?
검사 기관이 다르다고 이제 채취 문제는 그러니까 검출이 안 되는 문제는 없어야 됩니다. 그런데 이제 검사 자체보다는 이제 그 검사 전후 단계에서의 어떤 행정적인 오류에 의할 가능성이 더 커요. 인플루엔자 바이러스의 유전자와 코로나 바이러스의 유전자 염기서열이 너무 다르기 때문에 거기에서 어떤 좀 위양성이나 혹은 이제 교체 반응 같은 문제가 일어날 가능성은 굉장히 희박합니다.
Samples must be taken correctly in order to ensure reliable test results. However, many test takers have complained of discomfort and pain when the samples are collected from deep inside their nasal cavity.
제 친구가 코로나 검사를 받아봤는데 굉장히 아프다고 하더라고요.
고통 없이 검사를 받을 수 있는 방법이 또 있는지 알고 싶습니다.
Korea's health officials say they're deliberating over the adoption of an alternative testing method that's different from the ones currently used.
타액을 이용한 검사 방법도 도입 방안에 대해서 검토하고 있다는 말씀을 드리겠습니다.
Saliva testing for COVID-19 have already been introduced in countries abroad, with the US FDA granting emergency use approval for 6 types of saliva tests.
First, there's a significant reduction in PPE So nothing is needed except for a regular mask like you're wearing and gloves. You literally spit into the tube up to a line. You secure the cap onto the tube that has a preservation agent in it, and now that sample is safe to be tested.
However, experts say further improvements and modifications are needed in saliva testing.
네, 아직은 타액 검사법의 정확도에 대해서 이제 일관되게 좋다는 데이터가 나오진 않았습니다. 우리나라 당국에서도 그런 걸 고려해서 이제 현재 정확도 평가나 이런 작업을 진행하고 있습니다.
Accurate testing on a wide scale will continue to form a key pillar of Korea's fight against COVID-19 until a vaccine can be found.
The Nordic Talks Korea, an initiative by relevant embassies here in the country, seeks to foster productive dialogue between these two regions to better address global challenges. This year marks the fourth such session and comes at a crucial time given the raging pandemic worldwide. For more, I have one of this year's participants, Fatima Alzara Alatakti from Roskilde University in Denmark, live on the line. Hello, Fatima.
Hi, Sunyi.
Fatima, I understand that the event is being held online this year. Please tell us a bit about the Nordic Talks Korea.
Yeah, so I'm actually very excited and honored to be invited to speak at the Nordic Talks Korea. The Nordic Talks concept is centered on the 17 UN Sustainable Development Goals and aims to inspire citizens to act for a more sustainable society. So in today's particular event, the focus will be on ensuring a healthy future and to increase Nordic-Korean cooperation. So it's going to be an extremely interesting program where new insights and ideas will be shared. And the organizers of the event, especially the Innovation Center Denmark and the embassy, has been absolutely great to work with. And together with the other Nordic embassies in Korea, they have created a very intriguing and important program. I would absolutely recommend to follow the event online later today.
I see. What will you be addressing during this year's talks, in layman's language, of course?
Yes. So I'm going to talk about the fact that despite the COVID-19 situation, we still have other serious problems we need to encounter. Antimicrobial resistance, AMR, is a threat we are facing, and this is something we've known about for a long time. Our antibiotics are becoming less and less effective, and we're running out of new ones. So in practice, it means that increasing AMR may lead to people dying from regular infections. And in my talk, I'm going to suggest how we can learn from bacteria how to combat AMR, because bacteria have their own language they use to communicate with each other. For example, to coordinate infections in the human body. And if we're able to understand bacterial language, we can utilize this knowledge in developing early diagnosis technologies or alternatives to antibiotics and even vaccines. So in my opinion, we need to go all in with innovative, creative approaches to defeat AMR.
I see. Now, your contributions, Fatima, in the field of health and science have been highly acknowledged. And last year, your name was included in Forbes' list of 30 most influential people under 30 in Europe within the same sector. Speaking within that capacity, what are your thoughts on the current global COVID-19 situation?
So it's, of course, a very tragic pandemic where a lot of people have lost their dear ones. But what we're facing today is a practical opportunity to truly learn how to deal with pandemics in a modern world. When the pandemic hit the world, each country had its own strategies to deal with the spread of infection. Some countries chose a full lockdown, others relied on creating crowd immunity, massive testing, and so forth. In the coming time, we will see major evaluations on the different strategies that have been followed, and this will make us learn more about how to create an infrastructure and a solid contingency plan if the world is going to hit by a more deadly virus than SARS-CoV-2.
I see. What is the situation like in Denmark? I mean, how are experts like yourself assessing the situation there and the efforts to control the outbreak?
So, Sunny, here in Denmark, the government chose a lockdown strategy on the 13th of March, meaning that the whole public sector closed or were sent home to work from home, of course, with the exemption of critical labor like health care providers. But today, all residents have access to be tested at local test centers, and the testing capacity has increased since the beginning of the pandemic. We had a gradual, controlled opening of the society during the summer, but recently we have experienced increasing numbers of infected people, which could be due to local outbreaks or it's simply a second wave. So based on this, we have the government was out again recommending that everyone should work from home if they can. And yeah, there are some restrictions that weren't there previously.
Before you go, are there any final words of advice that you would care to share with our viewers amid the pandemic, Fatima?
So in my opinion, we're experiencing a global awareness, and what we, with regard to catastrophes, global catastrophes, and the impact of science and research to solve these problems. So I think what we really need to pay attention to is, one, to have a strong research and political complex that allows quick decision-making based on solid science. And two, we need to strengthen the research financially and strategically, so we don't, first when the problem hits, then we act to it. We have to sustain this, this research. And three, we need to strengthen our coordinated efforts across the globe, and we shouldn't be knee-deep in a crisis before we take action. So here the Nordic Talks, again, is one of the initiatives that seek to create this dialogue between countries to ensure resilient health systems and global health preparedness.
All right, Fatima, thank you very much for your insight, and thank you for making the time to join us live at this very early time in Denmark.
My pleasure, my pleasure.
Достаточно эффективно, формирует иммунитет устойчивый. Повторяю, прошла все необходимые проверки.
The vaccine will be very safe and very effective, and it'll be delivered very soon. You could have a very big surprise coming up. I'm sure you'll be very happy.
WHO will not endorse a vaccine that's not effective and safe.
The presence of a vaccine against COVID-19 is the key to ending mask mandates and social distancing across the globe. Now, quite a number of vaccine companies, including those here in Korea, are conducting clinical trials, and today we address their safety amid news of some side effects. I have Dr. Anne Wartel from the International Vaccine Institute. Hello, Dr. Wartel.
Good afternoon.
And in the spirit of social distancing, I have Professor JustinFendos from Tongseok University live on the line. Good to see you again, Professor Fendos.
Thank you for having me.
Right, Dr. Wartel, then we'll start with you. Let's begin with the progress so far on the vaccine front. Do tell us how many vaccines are currently in phase 3 clinical trials?
Right. As of today, there are 243 vaccine candidates being developed. And among those 243, 43 are in the clinical stage, which means they are being tested in humans. And in the late stage, the so-called phase 3, late stage of development, there are 8 or 9 vaccine candidates. When you look at the vaccine, when it becomes available, before that, the vaccine is licensed, there are different stages that you need to go through in humans. You start with the phase 1. Usually it's primarily a study that that want to look at the safety profile, and you also want to look for antibody response. And this is the earliest stage in human, the phase 1. And then you want to recruit actually a quite small number of healthy adults. If everything is going right, then you move to the phase 2, when you have a larger sample size, more subjects to be enrolled in the study. And at the stage of the phase 2, you want to look at again the immune response. And most of the time, this phase 2 trial usually takes 1 or 2 years or so. And then you enroll hundreds of volunteers in the phase 2. Then it comes the phase 3. when you want to demonstrate the vaccine works, it's safe and protective. And at this stage of phase 3, you enroll thousands of volunteers. So as of today, there are 8 or 9 vaccine candidates at the phase 3, the latest stage before licensure. And there are studies of the phase 3 being conducted in different parts of the world. You have studies being conducted in Europe, in US, in Middle East, in Asia, in China, Russia. So there are a lot of phase 3 trials being conducted worldwide.
So the race is on then. Right. Professor Fendos, where does Korea stand with regard to the quest for a vaccine?
The Korean vaccine ecosystem, I think you could kind of divide into 2 different layers. So the first layer are these companies who usually got a pretty quick start on this in March or April, who originally were trying to develop a novel vaccine, so a new vaccine from scratch. And I think originally most of these companies were thinking that the doses that they would need wouldn't be that high, maybe in the tens of thousands, hundreds of thousands, or maybe a couple million. But now that we know that this is a full global pandemic and we might need to immunize the entire population, the strategy has kind of shifted so that a lot of, especially these larger companies, are trying to get partnerships with a lot of the foreign companies that are kind of at the forefront at these phase 3 trials. So SK Biosciences is a good example. They have established a partnership with Novavax as well as AstraZeneca. And the idea is to try to establish some of that vaccine manufacturing infrastructure in advance. So if one of those vaccines does pan out as being the good one, then Korea can kind of get a head start on manufacturing it for domestic consumption.
I see. Meanwhile, Dr. Wartel, earlier last month, Russia registered its first vaccine following phase 1 clinical trials, which involved, I believe, 38 people, and one of them was President Vladimir Putin's daughters. The vaccine earlier this month started phase 3 clinical trials, I hear. And over in China, some 350,000 people were administered a vaccine that is still in the late stage trials. Now, these events have, of course, sparked fears, concerns, that is, over safety. Do you share these concerns?
A phase 3 trial done to international standards that shows that the vaccine is safe and protects against infection or disease is the gold standard of any approved vaccine. Using a vaccine before it has been shown to be safe and efficacious or protective subjects vaccine recipients to unknown risk. It's actually not scientifically or ethically sound to do so. So it has the potential to undermine actually the public confidence on COVID-19 vaccine. And vaccine development can be fast, can be done fast, but it must certainly be done right.
I see. Professor Fendos, let's now turn our attention to reports of side effects amid phase 3 clinical trials. Can you tell us a bit about some of these side effects?
Sure. Yeah, so I think first it's important to, and I've done this and other people on the show have done this too, to separate the vaccines that we consider to be traditional, conventional vaccines from the more experimental types. So the conventional, traditional vaccines, you're growing the virus up in some fashion outside of our bodies, killing it or disabling it somehow, and then injecting it into us so our immune system can mount a response. For the experimental types, there are many different categories, but a lot of them, especially the ones that are further ahead on clinical trials, are methods for trying to express viral protein in our bodies. So instead of making those proteins outside, we're trying to make it in our bodies. So I think it's important to kind of have a benchmark understanding of, for these conventional, traditional vaccines, what are the kinds of side effect levels that we're accustomed to? So I'll use the flu vaccine as an example. And so for 1 million immunizations, usually you'll get a couple hundred, sometimes thousands, who get very mild symptoms, things like runny nose, runny eyes, coughing, things like this. And these are usually very similar to allergic reactions, and usually they're very mild. And then depending on the vaccine type, sometimes you get people who get these kind of respiratory symptoms more severely, but even these are usually 100 or 200, sometimes 300 of those 1 million people who were vaccinated. And then very rarely you'll get something called Guillain-Barré syndrome, which is an autoimmune disorder in which after you receive the vaccination, your immune cells, for whatever reason, decide to start attacking your nerve cells. And this is a very, very rare condition. And usually out of 1 million recipients of the vaccine, maybe you'll have 1 to 8 or 10 who get this. So those are kind of the benchmark numbers that we're accustomed to seeing with traditional, conventional vaccines. But when it comes to these experimental types now, we're starting to see some symptoms that are slightly different. So for instance, AstraZeneca's vaccine, we're starting to see things like headaches and nausea, throwing up, things like this. And it also seems to be very dose dependent. So when they doubled the dose that they're currently using in trials, it seems that about 20% of the people would get these symptoms of varying severity. So there definitely seems to be a difference between what you're going to see from these experimental types and the traditional ones. And then the one that's getting all the news attention is the one from, I'm sorry, before it was Moderna that gives you the nausea and things. AstraZeneca's one was the one where that one patient appears to have gotten spinal inflammation. And this is, you could think maybe, there isn't that much detail about exactly what happened, but it kind of looks similar to Guillain-Barré's syndrome in that it might have been some kind of response in which the nervous system was attacked by immune cells. And this is why the US CDC has currently halted trials and is trying to figure out what's going on.
I see. Meanwhile, Dr. Wartel, as part of efforts to address growing concerns that you mentioned earlier, the quest for a vaccine, that it's not being driven by politics but by science, we have a number of pharmaceutical firms that signed a statement pledging to place priority on safety. What are your thoughts on such action by the industry itself?
Whether you developed a vaccine in 5-10 year time frame, that is the traditional timeline, or you do it in 12 or 18 month accelerated timeline, the same quality and international requirements for safety and efficacy data generation apply to all manufacturers, which means that they still have to fulfill all the requirements before going to licensure. Remember, unlike treatments, vaccine is provided to healthy people. The importance of safety cannot be overemphasized. If you take the example of the US, 70 or 80% of American parents go ahead and give their children 14 different vaccines and up to 27 different vaccinations, sometimes 5 vaccines at once. So there is really a tremendous trust that these vaccines are actually doing good for diseases. And most parents have never seen these diseases personally. So we have to build on that confidence, and the only way to do so is to really establish that vaccines are safe and efficacious or protective. So the companies should, and they have actually committed to ensuring the safety of COVID-19 vaccine.
Right. Professor Fendos, a fresh challenge for the globe in the presence of vaccines now is perhaps the equal or fair distribution. Do you agree? And if so, is there a way to address this potential problem?
Yeah, so distribution is definitely going to be a problem, especially in the initial phases when you start rolling out the vaccine, because any company is only going to be able to put out thousands, tens of thousands, if they're really lucky, hundreds of thousands of doses per week or per month. And so, I hope every country is already discussing this quietly, that there should be some sequence of priority. Maybe the healthcare workers get it first, the elderly who are most vulnerable, most likely to die, get it next. So distribution is definitely going to be an issue. And when you compare country to country, even just for political reasons, the country that's actually making the vaccine is most likely going to give it to their population before they start exporting it elsewhere, which is again why Korea's strategy of trying to get in on that manufacturing, having these partnerships between Korean companies and foreign companies early is very useful, because you can get that distribution jump-started in your country. And I'd also like to say, Dr. Wartel is saying exactly the right stuff about confidence in the vaccine. And I feel bad, that I'm delivering this information about side effects and things like that. But confidence is of the utmost importance, because rolling out the vaccine is one thing, but getting the people to take it, that's a completely different issue.
Right. Dr. Wartel, the global health body has urged against the so-called vaccine nationalism. Now, President Moon Jae-in here in Korea also talked about the importance of vaccine multilateralism. What might be some ways to discourage the phenomenon of vaccine nationalism?
As we have seen so far for the last couple of months now, a number of high-income countries actually have announced prominent deals, right? And with large vaccine manufacturers for hundreds of millions of doses of vaccines that have not yet been shown to be safe and efficacious. But we have to remember, again, this is a pandemic that affects everybody. Until we are able to control the pandemic everywhere in the world, none of us are truly safe. So we just heard about COVAX initiative with WHO, CP, and Gavi. That is actually the result of an extraordinary and unique global collaboration with hundreds of countries involved now. And COVAX pillar is actually aimed at ensuring that every country gets an fair and equitable access to eventual COVID-19 vaccines, once, of course, demonstrated to be safe and efficacious. It's a sort of insurance policy, if you will. meaning that you have this largest portfolio of vaccine candidates that have never been seen so far. It's really unprecedented. Getting access to successful vaccine, having all these countries in, by pooling their buying power, actually, rather than competing against one another, they enable actually investment in factories. So therefore, there will be more doses available as soon as vaccine becomes readily, available for people to get vaccinated. Right. So it's a remarkable initiative. And Gavi, who is coordinating COVAX, said the main goal of COVAX is really to provide vaccine supply for 20% of the population of countries worldwide at an equitable speed by increasing supply to those countries.
And hopefully they'll achieve that purpose.
I
All right,
so.
Owing to the lack of time, I'll have to end our session there. Dr. Wartel, thank you for being with us.
My
and
pleasure.
Professor Fendos over in Busan, thank you for being with us today as well. Well, that ends our edition for today. Tomorrow, we address ways to deal with the protracted battle against the pandemic that is now entering its 9th month. Thank you for watching and be sure to join us again on Friday. Take care.